hello. Good morning, everyone. Can you all hear me?
Yes.
Yes. Great. Okay. So first of all, I would like to introduce myself. My name is Charlene. I'm the MC for today. And I would like to welcome you all to join us for today's sharing session by our special guest, Professor Dr. Aziz. So first of all, I would like to know how many of you have actually attended the class by Dr. Adiba on Tuesday? If yes, give me a me. Right, great. So don't you think we are lucky that we are able to have two renowned doctors to share with us their professional knowledge in just 4 days' time? Yeah? Yes, very lucky of us, yeah? So aren't we all lucky to be in this part of BOI system, in this great team? Yes, okay, great. So I would like to, before we start the session today, I would like you all to take note of 3 things, which is please do not on your microphone during this presentation, and also do not scribble on speaker slides. Okay, and also the most important thing is if you want to on the camera, please make sure that you are properly dressed. Okay, so and very important is please get ready your paper and pen so that you can jot down all the important notes given by Professor later. Okay, so without further ado, let me actually give some brief introduction of Professor. So Professor Dr. Aziz holds a position of Professor in Epidemiology and Deputy Coordinator of Diabetes Center, University Hospital of Science. He obtained his PhD in the University of Liverpool, UK, and MD from National University of Malaysia, Kuala Lumpur. He is also an advisor to the Kelantan State Road Safety Board and heads the research unit of the bodies such as Malaysian Medical Association, Malaysian Society of Health, British Diabetic Association, International Diabetic Federation, American Diabetic Association, council member of Malaysian Diabetes Association, secretary of Malaysian Diabetes Association, Kelantan branch, Malaysian Public Health Specialist Association, Academy of Medicine, College of Public Health Medicine Specialists, and committee member of Action on Smoking and Health Malaysian Medical Association. Professor Dr. Aziz received honors including Excellent Award from Ministry of Health, Malaysia, and from University Science Malaysia. He successfully completed number of research projects, okay, founded by different agencies. Professor Dr. Aziz had a number of publications in his peer-reviewed international journals such as Diabetic Medicine, various Best Practice and Research, Practical Diabetic International and International Journal of Epidemiology, as well as proceeding and abstract of paper presented at major meeting conferences. As a recognition of his expertise and experience in the field of epidemiology and diabetes, he has also been invited to give lectures by other universities on a number of occasions and to examine theses submitted by students for Master of Science and PhD degrees. So now, without further ado, let us give a big round of applause to welcome Professor by typing 933 in the chat room.
Thank you very much, Charlene. Assalamualaikum warahmatullahi wabarakatuh, and very good morning to everyone. Okay, how are you all? I hope you all enjoyed last week's presentation, and today we're going to discuss on heart disease. Yeah, heart disease. Let me share the screen so that everybody can. Okay. Do you hear me clear? Okay.
Yes, Prof.
Yeah, okay. First of all, heart disease is very important to everybody. I hope everybody knows that ischemic heart disease or heart disease is the main cause of death. Number one, for the last 6 years, remain number one, be it in Malaysia as well as in other part of the world. Worldwide, heart disease is main cause of death. This one is Malaysia. If you look here, ischemic heart disease. So what we're going to discuss today is about heart disease. So heart disease is the main cause of death. So welcome. Before that, I would like to welcome everybody from Malaysia, from Philippines, and from other part of the world as well. So if you look at here, world leading cause of death, ischemic heart disease is the main cause of death. And then stroke second, then come to respiratory or lung disease. So if you look in Malaysia, ischemic heart disease is main cause of death, and worldwide also ischemic heart disease. So we're going to discuss about ischemic heart disease and other type of heart disease as well. Okay, this is a heart. This is the heart, and where is located in the chest wall there. So this is the size of the heart, and this is what we call electrocardiogram. Electrocardiogram is a measure how good is your heart. You see this one, how good is your heart. So if this is the normal pattern of the heart. So like the one in the first slide I showed, that the actual pattern of normal electrocardiogram. Electrocardiogram meaning that we measure the electric impulse from the heart. So this is normal. If heart is abnormal, then you can see the one in EC, this electrocardiogram, we call it a short form ECG. Yeah, ECG, electrocardiogram. So from here, we know whether the condition of your heart is, say, for example, you had chest pain, shortness of breath, then if somebody bring to hospital, this is the first thing we do. We want to know how good is your heart, do ECG. So it's straight line, meaning that you already dead. So that's it. Okay, this is normal heart. Your heart is an amazing organ. It's continuously pumping oxygen and nutrient-rich blood throughout your body to sustain life. So what are the size of the heart? The size of the heart is the size of your they call it your size, your fist size. And the contraction, the contraction, pumping about 100,000 times per day. That's how good is your heart, pumping 100,000 times per day. And each time, every day is pumping about 2,000 liters every day. So this is the structure of the normal heart. I just wanted you to aware how the really amazing organs the God create for all of us. Actually, the heart have two rooms. We call it the two blue and then the one in red. The one in blue we call the first one here. Yeah, here we call it. RA, right atrium, meaning the right atrium, and then left, this one, right ventricle. So this is where your heart got our blood, which is unoxygenated, without oxygen. The blood comes from all over your body. This from your lower limb, your leg, this from other part of the body, from brain, everything all enter here. From right atrium, this is what we call valve, tricuspid valve. And then from here, go straight to the lung. Yeah, go to the lung, and then at the lung there is an exchange of blood without oxygen and with oxygen. Yeah, and then from the lung, come back here to the left atrium, to the left ventricle, and then go back to the whole body, supply the whole body, including the brain. So they call it aorta, go to the brain. Okay, so and then if you look at the X-ray, this is the size of the X-ray of your heart, yeah, of your heart, and then the lungs there. So from the X-ray, you already know if somebody come to you, complain of the swollen legs, for example, the first thing what we want to know, how good is the heart, we do just X-ray. From X-ray, from the size of your heart, we know already this is whether the heart is enlarged or not. And then from the X-ray itself, we can see whether there is water or not in it. Somebody requests me to speak both Malay and English. I'm not sure. How is it? The organizer. Okay. Okay, this is the heart, yeah. And then to pump the blood for the whole body, you know, this is the one in blue, actually, the blood without oxygen. So blood without oxygen come from all over the body, from the legs or your arms or your brain, and come to your right side of the heart, and then go to the lung. Then the red one is the blood with oxygen, we call artery. Blood without oxygen, we call vein. So there are two different systems. Okay, and then how long is, if you mix all this vessel, artery, and then the blue one without oxygen, and the capillary is the small one. Yeah, the small one. This, if you combine all this, you know how long is your this blood vessel all together? 60,000 miles long, meaning that's long enough to go around the world more than twice. That to shows how big is your system. Okay, another one here. If you look here, yeah. This is the actual, this is number one. So in ECG, actually the aim is not to teach you about ECG, but just to make you aware the ECG and how to, I mean, if you look just enough to know whether this normal or not normal, that's all. Okay, if you look this one, this is we call ECG or electrocardiogram, ECG like this one. So this, actually they have specific pattern. This is what we call P, and this is Q. They have Q, this is R, and this is S and T. You no need to remember, I just want to, we doctors know what we call it. So P, the pattern is P, Q, R, S, T. So for each curve here, we present something. So if say somebody have a heart attack or chest pain, we bring to the hospital and then do ECG. Then looking at this, we already know whether severe or not, whether you should be admitted to ICU, CCU, or just to remain in the ward, or can send you home. All this actually come from here. from looking at your ECG. So this very important, ECG. So if you go to ward and to ICU visiting your friend or your relative or your father, mother, these are the number that you see. Yeah? This is the first one, pulse. Pulse meaning that your pulse rate or how fast your heart beating. This is what we call pulse is mean heart beating. 70, that's nice. We want average 72, so 70 is okay. So if too fast, say more than 100, more than 120, that's dangerous. You become abnormal. Or even if too slow, meaning that about 30, 40, that's also dangerous. So you just want it to be just nice between 70, 80, just nice. So this is 70, average is 72. So actually the athlete have lower pulse rate. If you're doing exercise every day like Celine, then the pulse rate probably lower. So athlete has a lower pulse rate because the heart is so strong, then it's no need to pump too frequent to get the amount of blood. Yeah. So if you are athlete, then probably your pulse rate is lower because your heart is so strong. One stroke or one pump, you can deliver 3 liters, 4 liters of blood. But for people who are not doing exercise, you need to pump more and more. That's why your pulse rate is higher. The up here, yeah, this is what we call systolic, meaning that the pressure during the when the heart is contracting. So the pressure, blood pressure, we have two. This what we call systolic, the one up here, and then lower one is diastolic. Then another one is SpO2. Now during COVID-19, somebody who has COVID, actually this virus, coronavirus attack the lung. So once the coronavirus attack the lung, your SpO2 will be reduced. So this the single most important gadget or things that you want to do, you want to have if you have an attack of COVID or if you're swab positive. The single most important thing is to measure your SpO2, they call it SpO2, meaning that the pressure oxygen in your body. Anything less than 97 is dangerous. So your normal reading must be 97 and above. So if below, constantly below, then it's a time, if let's say, for example, you have a COVID positive now, and then you plan to have a quarantine at home, what to measure is to measure SpO2. So if SpO2 below 97 is a time to call ambulance, go to hospital. But if your SpO2 maintain at 97, 98, then it's okay. And this another, the below one here is this what called respiratory rate. Respiratory rate meaning that how fast is your breathing. Your normal breathing between 12 to 16. 16 times per minute you're breathing. So anything below this too slow, also dangerous, too fast, also dangerous. So these are the normal thing that you should know. Then you probably the intention is for you to be able to say this is normal, this is abnormal, then you need attention. That's all. So if flat, meaning that you're going to go anytime. Okay. Are you clear at that? If you clear, you just say type 1 there. So I just want to know whether you clear or you is it too fast, too slow. Okay. Okay, that's one. So the main disease we want to discuss today is about 4. One is coronary heart disease, angina, heart failure, and myocarditis. Myocarditis actually, I not normally discuss myocarditis, but nowadays because of the coronavirus and then also the vaccine, so I need to mention about myocarditis just for you to aware about this condition. Okay. Okay. the Asmawi mentioned this. No, it's not like no. This for medical lecture is more than this. It's just for you to understand, meaning that we want somebody, if you are together with me in forever, I mean, you just mention things we don't want to give the false information, that's all. So coronary heart disease, what is coronary heart disease? Coronary heart disease, also known as ischemic heart disease. Yeah, ischemic heart disease, a coronary artery disease attributed to the reduced blood flow to the heart. Okay, what happened? I show you the condition of the blood vessel to the heart later on. Caused by atherosclerosis. Atherosclerosis is the thickening of the blood vessel. Thickening of the blood vessel, we call atherosclerosis. What's the reason for that? Probably because of the cholesterol, high cholesterol, or inflammation. So because of the atherosclerosis, you have angina. We call angina pain. Angina is chest pain, which is totally different from other type of pain. If somebody have a chest pain, the peculiar chest pain in heart diseases, you feel the pain is so severe. It's like somebody stab you on the chest, stab with a knife or with a grace or whatever on the chest. Very severe. This is what we call, and you cannot stand because of the pain. So the first thing, if somebody has chest pain, and if we suspect there is the heart angina or ischemic heart disease or myocardial infarction or heart attack, is all the same term. So if we suspect chest pain because of the heart attack or because of the myocardial infarction, the first thing we do is we do the sedation to sedate them, to what we call it, ask them to calm down because of the pain is so severe. Angina pain, Mardiha Farid mentioned the angina pain, sakit dada yang teruk. Yes, that's it. Okay, so the importance of coronary heart disease actually, or ischemic heart disease or angina pain, is you have to get it help or treatment as fast as possible. If you delay the treatment, then you might end up with that. So that's why very important to know what type of chest pain is that. The faster you act, better the outcome. Okay. Incident of coronary heart disease every 40 seconds. Meaning not even 1 minute. Every 40 seconds, someone in United States has heart attack. Here in Malaysia also the same. Even though now we have the problem with the COVID-19, but still we have every minute there's somebody who died of the heart attack. Every year there are approximately 1.2 million new and recurrent heart attack in US. So the same thing here also. Even though we struggling with COVID, you see the how many 5,000, 6,000 every day. You see, then that's the heart attack main cause of death. Atherosclerosis, yeah, jantung tersumbat, that's right. This because of the block of the blood vessel. Okay. So if you remember a few weeks ago, somebody who died while training, or there is a football player died in the field. So all that because of the heart disease. Somebody who drive and then died. The one, if you remember, the one doctor, anesthesiologist or specialist in Johor Bahru, driving, I think, if I'm not mistaken, driving the Porsche. Yeah, Porsche, and then have a heart attack and then died on the spot. So this is the severity of it. So wherever you go, if you have a history of the heart attack, and don't ever travel alone. So you must be accompanied by somebody, by your spouse, your wife, or your husband or whoever that can help you if you're having an attack. Yeah, Batu Pahat. That's right. Asmawi. He's actually from Kota Baru originally, but now working in Batu Pahat. Okay, that's because heart attack. So an estimated 80 million Americans have one or more cardiovascular disease. So there are many types of cardiovascular disease I mentioned just now. Coronary heart disease account half of it. 52 of coronary cardiovascular death rate or CHD. Coronary heart disease. Coronary heart disease meaning that not only because of the heart, but also because of the blood vessel. Peaked in 1963 and have steadily decreased since 1968. Okay. So atherosclerosis, meaning that thickening of the artery wall. So when the artery wall thickening, this make the narrowing of the arteries. So when the arteries is narrowing, the decreased blood flow and increase the risk of embolism or blood clot. Factors that contribute to development is the inflammation. Remember, inflammation, calcification, and deposit of cholesterol. So the first thing happened, actually inflammation, not because of the cholesterol. So even though your cholesterol sometimes very high, but if there is no inflammation, there is no reason to worry. So that's why the use of the supplement very important. This is the part that most doctors not aware. They thought it's just because of the cholesterol, and then they bang all the anti-cholesterol drug. Two types. One type is not enough. Sometimes two types of the anti-cholesterol drug, but they are not focused on inflammation. Inflammation meaning that in Malay we call keradangan, and the cause of this inflammation is because of your blood vessel, a lot of oxidation process. So that's why the importance of supplement here, because the way that supplement works, they will say vitamin C, vitamin D, vitamin E, all actually the reason is we use that one to reduce inflammation. So once you reduce inflammation, there is no spot for the cholesterol or fat to be deposited, and there is no calcification. So the first thing is the inflammation. Sometimes people take it easy and they say, no need, why you need to take a vitamin C or vitamin D supplement? Why you must take all the supplement? They say, forget it. So that's actually wrong information, because the first thing happened in the atherosclerosis is not because of the high cholesterol, but it's because of the inflammation. If there is no inflammation, cholesterol won't deposit in the blood vessel. So this is actually important, very important for you all to understand why we need to take the supplement. And then somebody said, why you need to take all this pill? Won't that enough if you take the lemon or take orange? It's not enough. Why? Because the quality of the lemon or orange that we have nowadays is not same as 20 years ago. Yeah, even though you take a same amount of lemon or whatever fruits, but the quality, the vitamin C in it, very low. So that's why you have to have a proper vitamin C supplementation to reduce inflammation. And furthermore, because there are certain group of people, especially pharmacists, already aware that more and more people looking for vitamin C and all other supplements. So what they do, they just mix in the lab. Then they come out with the vitamin C, but this is the vitamin C from the lab, not from the original fruits. So that's one also is not good. That's why if you take vitamin C, even though you take 1,000 milligram, it won't be effective. Why? Because not the real or not the organic vitamin C. So you look here, process begins from childhood, in childhood. Okay, so this is what actually happened. You actually start from here. This from your right side, so normal artery. You see normal artery. So what happened actually? Inflammation. Inflammation. Look here, the inflammation. Yeah, inflammation. So this inflammation, because of the inflammation in the blood vessel, so this inflammation will attract all the fat cholesterol from here, yeah, to here. And then from the small one, it become bigger and bigger, become atheroma and fibrous plaque, and then to this point. So if this happen uh, to the artery, to the blood vessel over the heart, and then what they can do, actually, they do the bypass, or we put stent. They put, if like this, you still can put stent, because you push for stent, you need to push this tiny little thing into here. So this one, but for this size of the obstruction, you cannot do anything. Or like this one, totally occluded. Totally occluded. So you cannot do. So what you have to do is just cut it and then take blood vessel from other part of the body and then put it there. This is what we call bypass. You see? But the thing is, if this changes happen in the heart, does the same thing happen in your brain? To the blood vessel in the brain, the same thing. So the same thing happen to the blood vessel and your kidney, to your vessel and your eyes. So that's why the changes, with that changes, you will end up with all the problems. Yeah. So that's why people, after they do the operation, let's say bypass operation for the heart, and probably while in the ward, have an attack, the stroke attack, and die. You know, what's the reason? Reason is because the changes or the things that they do, the operation is only for the heart. They didn't change anything to the brain, to the blood vessel in the brain. So the same pathology happened, then it's died. It's as simple as that. So if you look here, this actually, again, for the illustration, how this block happened. It starts with here. Atherosclerosis, a lifelong process beginning in childhood. From childhood. So what happened if you didn't take any supplement? I mean, if your food, meaning that your food is too bad, contains all fat, every day or every week you take KFC or McD, so all the fat there will stimulate what we call inflammation. So it stimulates inflammation, and this inflammation will attract all the fat and cholesterol. Look here, fatty streaks result from the build-up of fat in the artery wall. So become bigger and bigger and bigger and bigger. So the issue now is how to prevent this from happening. Yeah. So this is the role of the supplement. I really believe in this because we can compare those who on regular supplementation, this process won't happen. Their artery is as good as a normal kids. Okay, so this is the how the heart. If you have an heart attack, this is how you can see, because let's say this is the plaque because of the blood clot, and then cholesterol plaque, and then the blood vessel is totally blocked. So once it's totally blocked, because this is the blood vessel at the heart, you can have at the right here, then the coronary arteries, right coronary artery, left coronary arteries, and then one is blocked here. The blood cannot flow to this part of the thing. So once the blood clot and then it block the flow of the blood, this will cause severe pain, unbearable, very severe pain, and this is what we call heart attack. Yeah, this is what we call heart attack. So here is one is blocked. So what happened? Doctor will do either they do the bypass surgery, cut here, and take blood vessel from your leg and then put here. This is what we call bypass. And then when help this, the part of the body can improve the circulation. But the thing is they didn't do the changes here, this one or this part. take for example, at this point, they have 50% of the block, meaning that this is totally blocked. But if 50% of this vessel blocked, then you have problem as well after 3 years, after 4 years. So if you see, if somebody had an attack, they do bypass, after 3 years, then they have an attack again. This is what actually happened. Okay. Any question at this point? I hope I'm not confuse you by all these jargon terms that probably you never heard before. So the same thing happened in the brain. So if this happened in the brain, we have a different term. This is what we call stroke. Yeah, this is what we call stroke. If it happen at the heart, we call it heart attack. So the same procedure. Okay. Now, this is what we're looking for. So if the block is not so severe, this can have omega-3, omega-9. Help support healthy cholesterol and triglyceride level will reduce. Support, and not only to reduce cholesterol, you know, because probably you all know that we have 4 types of cholesterol: total cholesterol, HDL cholesterol or good cholesterol, LDL cholesterol or low LDL cholesterol or bad cholesterol, and the other one triglyceride. This is what we call healthy cholesterol, meaning that this HDL cholesterol, triglyceride. So apart from cholesterol, support brain health, cardiac function, cognitive function, memory, help optimize joint function as well. And also RTC, omega-3, omega-9 also have anti-cancer property. Anti-cancer property. There are many studies doing that. So if you take this, the important thing is you must take this before you have an attack. So you and this is very important for us to aware, yeah. To aware that this thing you must take before an attack. So once you have an attack, probably this won't help much compared to the before. So this omega-3 from all this what we have is salmon from the RTC, and the other one is from the best olive oil, and then on top of that we also have vitamin E. So we have omega-3 from the fish oil, and then we have omega-9 from olive oil. So to fight cholesterol, we must have two, both omega-3 and omega-9. And additional, you have vitamin E, that additional. So it's not enough to say just to take fish oil, or if you just take olive oil, it's not enough. So must have both omega-3 and omega-9. Okay. Okay. So this again, another representation for the cholesterol. Okay, this is another aspect. Just now, the first aspect I mentioned, the blood vessel affected by the cholesterol or fat deposit. Yeah. Okay, now another aspect is what can dilate the blood vessel, because since your blood vessel is constrict and can become smaller, are there a way to open up this blood vessel? Yes, there is a way through a miracle molecule. This is what we call nitric oxide. So the metabolism, the way that they act is actually different, totally different from the omega-3, omega-9, from the cholesterol. So the way is this, what we call opens this nitric oxide. Nitric oxide can open blood vessel by 62%. It's very good. It's very significant. Yeah, very significant, because this molecule can open up blood vessel. And the one who found this molecule actually won the Nobel Prize for this discovery. They discovered that nitric oxide can open up blood vessel. Yeah, very good, this one. So how is that? Now this is the way that nitric oxide react. So you no need to remember all this thing. So you must just remember that there is a system where you have nitric oxide in the body. So with nitric oxide can increase the opening, make the size bigger. You know, from this size of the blood vessel become bigger like this. So this is very important for both. It's not only for your heart, for your brain, and other part of the. So for my patient, I use this medication to open the blood vessel. It's not only for those who have a heart disease, also for the people who has a kidney disease. Very important, and also gangrene. Okay. If you use maybe your father or your mother or your relative go to hospital, they said doctor give medicine for thinning of the blood, thinning of the blood. So that medicine only effect on the just thinning the blood, yeah. But the one that nitric oxide have 6 other function. You see, look here. If you just give the thinning of the thinning medicine, thinning blood medicine, the action is only here. You see, only here. Reduce this what we call what? Reduce platelet thickness, meaning that platelet didn't get together. But it didn't dilate the blood vessel. Didn't dilate blood vessel. Didn't reduce LDL cholesterol. Didn't and other effects, superoxide, this all the other effect, reduce multiplication of the small muscle and the thing. So for this nitric oxide, they have how many? 1, 2, 3, 4, 5. 5 other mechanism which is superior than that thinning blood pill. You see? So that's why I didn't use this thinning blood pill because we have something else which can have 5 other mechanisms beside the thinning of the blood vessel. Okay, yeah. So if you look, what's that like this one? When you child, see, you have 100% nitric oxide. So if you become older and this is the age of 20, blood vessel very good, yeah, and then become lesser and lesser and lesser, and at 60, at the age of 60, your blood vessel only half the volume, and then nitric oxide also about 15% of nitric oxide only, compared to 100% at the age of 20. See, as we age, we lose 85% of our ability to make nitric oxide. So how to overcome this? Any idea? Any idea? Are there anything that can open up the blood vessel? Yes, Clement Wong say RG. That's right. Clement Wong, thank you, Clement Wong. So this is RG. See, this is the things that can improve the opening the blood vessel. And the most important thing, if you look carefully, the active ingredient in RG plus actually what we call L-arginine, 5 grams. No other products in the market has L-arginine which is more than 5 grams. So far, RG plus is the highest concentration of L-arginine. I compare, if you want to look, I compare. I don't care whether they are angry with me or not, but I have to compare. So this is another product which they claim they have L-arginine, but they're not there to declare how much, meaning that too small. They can't even say how many milligrams. L-arginine, they put there L-arginine, but they didn't mention how much L-arginine. So this one, 5 grams. So that's why once you take this, I mean, they can improve the blood vessel, then they can overcome, especially this one, good for stroke, good for the heart attack, and good for other reason, which is probably some of you will smile all along, like this one. So it's good for this one as well, for those who have or the power is poor power. So this one is so good. Why? Because this one, nitric oxide, reduction in nitric oxide will affect the erection. So why? Because the cause of the reduce in nitric oxide, free radical stress and excessive and allergen reduction. So the best supplementation is L-arginine from algae. Okay, I think we leave there for the time being. Okay, now the next one is myocarditis. Myocarditis, as I mentioned earlier, myocarditis is an inflammation of the heart, inflammation or keradangan jantung, inflammation. Why is happened? One of it is this one, myocarditis in young people after mRNA COVID-19 vaccination higher than expected. This is reported all over the world. And then actually this the main the reason some people die a few days after vaccination because of the myocarditis. Could the Pfizer vaccine lead to the heart inflammation? A report found a link to myocarditis. The other one, myocarditis. A new report takes a close look at 17 boys. This is from UK. Look at 17 boys who developed myocarditis after COVID-19 vaccination, is of whom had similar symptoms, timing, and outcome. If you remember, one of our athletes also died a few days after taking this. There was somebody who fit before and end up with myocarditis. So this very important. Okay, this is what we call the myocarditis. The cause, we have this one, the acute cause and chronic. Acute meaning that the immediate cause. This one long time. So the first one is cardiomyocyte injury, SARS, coronavirus gaining entry into the cardiomyocyte via ACE2. So that's one of the reason how it's happened. Pericardial inflammation, inflammation of the heart. Yeah, this one. Massive pericardial edema, effusion seen in fulminant myocarditis could precipitate arrhythmia. Arrhythmia meaning the abnormal pumping of the heart. The other one, microvascular ischemia, cause the blood vessel cannot flow. SARS-CoV coronavirus might damage the pericyte around the cardiac microvasculature and causing ischemia. Number 5, gap junction dysfunction, and the other one is non-ischemic scar. So that's how we should look at myocarditis. This is myocarditis. And then myocarditis not only caused by virus, but they also can cause by the other thing. Things like bacteria, parasite, cardiotoxin, meaning the toxin to the heart, systemic disorder, radiation, hypersensitivity, or meaning that there are other reasons for the myocarditis, not only viral infection. There are many other reasons. Diagnosis, endomyocardial biopsy, clinical presentation, and then MRI. And how is present? Excessive fatigue, tiredness, exercise intolerance. You cannot do exercise, you'll be so tired, you cannot do any exercise. And then chest pain, pericarditis, unexplained sinus tachycardia, meaning that your heart pumping very fast, so more than 140, 150, or 160. And then you see abnormal ECG, yeah, ECG, heart failure elevated. So after this, we're going to discuss about heart failure. Okay. Management supporting heart failure. So this is what we call myocarditis. Okay, next one I want to discuss about heart failure. So if you have heart attack many times, then your heart cannot cope with that anymore, cannot pump properly, and later on it become bigger and bigger and bigger and fail. Meaning heart failure, meaning that your heart fail to pump properly. Then once it failed to pump properly, what happened? And this is what happened. You see, take for example, the easiest way is to look at the heart failure is you cannot move around, you have a difficulty in breathing or breathlessness even after taking bath, the breathlessness, or if you walk, you cannot climb stairs, even one stairs also cannot climb. This is a sign of the heart failure, meaning that the heart becomes swollen, and that's it. And your leg also becomes swollen. So skin pale, pale, gray, and cyanotic. Cyanotic meaning bluish discoloration of the lid. Your lid will be blue, your nail bed become blue. This is what we call cyanotic, because you cannot, because too much of carbon monoxide in the body, because your heart cannot pump properly. Dyspnea meaning that you restlessness. Autopnea, you cannot sleep flat, you have to sit down, or even you sleep also you cannot lie down, you have to sleep while sitting. Crackling waist meaning that when you take the breath and deep breath, we can hear your sound, and they cough because there is a lot of water in your lung. The blood pressure will be very low, 60, 40, or normal blood pressure, how much? 120/80. That's the normal. 133 at the upper part, and lower part is 80. That's the normal one. But for this one, heart failure, probably the upper one, you can have 80 or 70, and then the below one, 40. Then that's actually very bad. Okay. And then you have nausea, vomiting, nausea, or ascites, meaning that your tummy become bigger and bigger and bigger. Dependent pitting edema, meaning that swollen of the leg, both legs swollen. It starts from the ankle going up until your buttock, or sometimes up to your face. Falling oxygen saturation, if you look at oxygen saturation here, you look is below 90 lah, below 90, very bad. Then jugular vein, you can see swollen, and the vein and the necks, infarct and all those things. Enlarged liver and spleen as well, and then your urine also very low, urine output decrease. So heart failure, meaning that inability of either left or right ventricle to properly fill with or eject blood secondary to damage or weakens heart muscle, shortness of breath, then you feel fatigue, decreased exercise, fluid retention, pulmonary edema, and those things. So all that as I mentioned just now. Okay. So this is the symptoms of the heart failure, congestive heart failure. Shortness of breath, difficulty in focusing, you cannot focus anymore, fatigue, confused, lowered ability. If previously you can do a dumbbell few kilos, but now cannot anymore. Heart palpitation, your heart pumping very fast. Dry cough, we call it. You cough, but there is no sputum, no infection, and then swollen legs. Start from normally in the heart failure, the swollen both sides. It's not one side, both sides, both left and right swollen. It start from ankle going up to the knee, to the buttock, and later on to the even face also swollen. Okay, incident prevalence of the heart failure, approximately 25% of men and 45% women will develop heart failure within 6 years of having heart attack. So if you heart attack, and ultimately you end up with a heart failure. Why women more than men? Because normally it's happened at the 40, 50 years old. And your estrogen, your hormone, while you are still menstruating, your estrogen actually protective for heart disease. So when you stop menstruating, meaning that your estrogen level very low, so it's not protect anymore the heart, at that time. So that's why you have to take a lot of supplement before you enter menopausal age. So heart failure is one of the cardiovascular disease that is increasing in incidence, prevalence, and mortality. Cardiovascular disease, CVD is cardiovascular disease. Cardiovascular disease is the leading cause of disability in US. Also the same thing in Malaysia as well. So what are the attributes or what cause of the heart disease? One, of course, the lifestyle. 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 What a lifestyle disease have problems that react to changes in lifestyle. Diseases that are caused partly because unhealthy behavior. So what are, you already knows what are unhealthy behavior. They make breathing heavier and body oxygen low. Cell hypoxia is the driving force lifestyle disease. Okay. So, cause certain habit, behavior, practice, such as poor eating habit, inactivity, meaning that you didn't do any exercise, smoking. And then you have what we call controllable factor and uncontrollable. Controllable factor meaning that factors that you, the one that are controllable, there are few factors. This is the controllable factors. And this is the uncontrollable. You cannot control your father, your mother. You cannot control whether you're male or female, age, same thing. So this is uncontrolled, but you can control this one. This is what we call controllable factor. Okay, this is what we call controllable risk factor. The one that you can control, diet and body weight, you can control. So very important for you to do the weight, and you must know your weight. Daily level of physical activity. Do exercise every day. Yeah. Then amount of sun exposure, smoking and alcohol abuse. Sun exposure is very important. I saw there are many people who didn't expose themselves to the sunlight will end up with all sorts of problems because of the poor vitamin D. Vitamin D, Allah give free. Allah give free, but through the sun. So you have to expose yourself to sun at least 45 minutes or 1 hour every day. So for you to have enough vitamin D. So even though you take a meal or the thing, but if you don't have enough vitamin D, it won't be useful. So even though you take, you think you want to get calcium from milk, but you don't have enough vitamin D, so that milk is useless because that milk, the calcium in the milk cannot be absorbed because of poor vitamin D. So that's why I say no need to take a milk. Okay, uncontrollable factor, age, you cannot control the age, but you can be aged, but a healthy age. Race cannot control, gender, male, female, you cannot control. Hereditary, meaning that you got the disease from father and mother, that's cannot control, but you can control this part. This part you can control, overeating, excessive consumption of fat, smoking, chewing tobacco. So at this point, probably you remember Kiko Kobona. Kiko Kobona was diagnosed as thalassemia, and normally thalassemia, meaning that once you doctor say you have thalassemia, meaning that's the death sentence for you. Nobody could survive that time. So the doctor told her, you won't be able to celebrate your 50th birthday, meaning that 5 years after that. So, but now 68, I think her age at the moment 68, still survive and with glowing face. Why? Because she changed the diet habit. So type of lifestyle disease, cardiovascular, we mentioned, so all those related to the lifestyle diseases. We mentioned only one disease only, and part of cardiovascular meaning that stroke or those things, but I didn't mention, but I just focus on the heart disease only. Okay, this is what we call cardiovascular disease. So this is the factors that you should avoid. See, you should avoid. Once a while you can take like this one. like burger, you see, and then french fries. Actually, this one french fries is not good, especially those who are having cancer. All this actually contribute to this is what we call unhealthy diet. Okay. Again, the personality, you have to, even though you have a type A personality, meaning that you have different, the personality which is a workaholic, which is not good. Alcohol, consume a lot of alcohol, cigarette smoking, and that. So all these things, this is repetition. I think we. Okay, this is the sign and symptom of it. Early warning of heart attack, pressure in the chest, pain shoulder, chest discomfort, fainting, sweating, nausea. What you should do if you're having a heart attack? Have a victim sit down and rest, attempt to keep calm, loosen any tight clothing. If a victim has known heart condition, ask any chest, any medicine or not. Normally patient have medicine in their pocket. This is what we call GTN. You just put underneath the tongue, you will increase blood flow. So if you have RG plus, you take one sachet of RG and then give it. Assist the victim in taking medication. This one, GTN and other things. If the pain does not subside, promptly rest. After 3 minutes, take this one called emergency. So we skip this one. Age, we mentioned already. Age, socioeconomic status, also very important. Why socioeconomic status very important? Because if you are low socioeconomic status, you don't have means and ways to get a proper food, proper supplement on the thing, and then risk of having the heart disease and other diseases is very high. So that's why very important to have this one. So this is adverse behavior: poor diet, lack of physical activity, smoking, alcohol, all which can contribute to obesity, diabetes, blood pressure, and high cholesterol. This one, we skip this one. Okay, cost for the treatment, meaning that this is in US, 151 billion estimated cost of medical care, loss of earning, and loss of productivity. And again, then look at this one. 3 most prominent factors influencing economic burden. Revascularization procedure, meaning that you have to do bypass or those things, or have to do stent, hospital care, and medicine. So the most important is act before you get the disease. Take a proper things. Okay, this intervention. What should we do to avoid all this from happening? Okay, control modifiable risk factor, decrease cholesterol, systolic blood pressure, smoking, physical inactivity. This you can do. And then for the cholesterol, blood pressure, so I had experience in dealing with this one. So normally once people mention about hypertension, they just want to give medicine. That's not the way actually. So you have to control by other means, by doing exercise, doing sauna, the same. Recent effort in this area have accounted 44% decline in coronary heart disease mortality, environmental changes. Yeah? Secondary prevention, you have to check your blood pressure regularly. The same thing, cholesterol. So if you are at the age of 45 and above, you should do a blood test every 6 months. Then you know whether your cholesterol are high or not. Okay. Tertiary prevention, revascularization, meaning that if you have an attack, what to do? You do put stent or coronary artery bypass. Or you can do, if you don't want to do surgery, you can go for the next one, what we call external counter pulsation. So we have a means for that. I can share with you. This is what we have here at my center, what we call enhanced ECP. Very good, innovative way to treat coronary heart disease, stroke, CKD. CKD is chronic kidney disease, and gangrene. So no need to do operation, but we use this one. Okay, I think we we can see the video here. So this is what we call ECP.
Semula Amira.
So this is ECP. So if somebody has an heart attack or has stroke or gangrene, this is the machine that we use to overcome the problem. So the beauty of this machine, you no need to do operation. Second, you can attach, or you can focus in not only heart, you also for the blood vessel, for the hypertension, also for the brain, the blood vessels, for the stroke, and also other part of the body. Okay, so this is what we call ECP. Then, okay, community level, we do all other changes. Okay, so call for action. So if you have all this thing, or if you want to prevent that from happening, this is the basic. You have to tell patient, or you yourself have to take this. This is very basic one. So that one is, of course, we're talking about the blood vessel. So these are the things that to improve circulation, you have to take this. No other choice, no other ways you have to take it. But in order to this, to absorb very well, so you have to cleanse your intestine. So you have to do this one first. Take the aloe vera gel, at least 200 ml 2 times a day. Yeah, at least. So because this is the ways to clean your intestine. So you have to take a lot. Okay. Then for nutrient, at least you take honey, or you take again royal jelly or bee pollen, or better still you could take this one, forever life. See, this is the drinks that can increase your protein level, can give the enough protein for you. And then the other one is to increase immunity. Yeah, immunity for your body protection. So the best is the formastin, or this is the best, the highest number of the antioxidant. So they take this one, or take absorbency or vitamin C. If you have enough to support, then you can take garlic. Garlic is good for your heart disease, and then also bee propolis. Okay. So I think we have a project actually with all the things, healthy people by 2030. Many goals related to the heart disease, including reduced proportion of hypertension, reduced proportion of adult with cholesterol, and then reduce obesity rate. So we can have a plan for this, and using the natural way to achieve this. Okay, so I think that's about all I want to share with you. Then I'm okay. Back to you, Shalin.
All right. Thank you, Professor, for the valuable knowledge shared today. So, as based on the research shows that heart disease is still the #1 killer among Malaysians, I believe in other countries as well. So let's practice a healthy lifestyle today by having enough exercise. Food-wise, we also must look after the food intake that we take, and also based on enough supplements. And the most important is we must be always stay positive. Okay, so okay, we thank you, Professor, for his precious time to share with us this heart disease, and also we hope that in future, Professor will have more session with us to share more on other disease as well. All right. So okay. So before we end this session, maybe we can take a group photo together.
Wait.
let's take the products that you have.
Okay, I will take the picture for you all.
Right,
Hold
thank you.
on. Okay. Okay, hold on. Okay, first page, second page. Third page. Okay, done. Thank you.
Thank you. So before we end, maybe we can just finish it with our slogan, right?
Yes.
Yes. 1, 2, 3. Yes.
Yes.
No limit. Go, go, go.
Millionaire.
Millionaire.
Yes.
No limit. Go, go, go.
No limit. Go, go,
Millionaire.
millionaire.